Greetings from Krishna IVF Clinic. Warm welcome to all the viewers of this video channel on Facebook and YouTube. In today's topic, we will be discussing things related to embryo selection and also what are the factors that affect the success. IVF treatment is a complex and an emotional journey for couples struggling with infertility, and one of the important steps in IVF treatment is embryo selection. And in this blog, we'll be discussing how embryos are selected for transfer during IVF treatment. The process of embryo selection involves several factors. The first and the most is the morphology. That means embryos, when they are examined under microscope, they are assessed for their physical appearance, including the number of the cells and the quality of the cells, the shape and size of the embryo. When we say cell in embryo, it is called blastomere, and we also see for presence of absence of any abnormalities. Embryos with the blessed morphology are more likely to implant and result in a successful pregnancy. The important factors that are involved in the developmental stage of embryos can be dependent on the stage of the transfer, the type of the development, and depending on the policy of the clinic. For example, at the end of 30 hours, the embryo reaches a 2-cell embryo, and the end of 48 hours, they reach around 4-cell to 6-cell, and the end of 72 hours, they approximately reach 8-cell. By 90 hours, they reach a stage called compaction, also known as morula, in which the embryo becomes a ball-like. By end of 110 to 120 hours, a blastocyst is formed. The choice and stage of an embryo transfer selection depends on how many embryos are available, the woman's age, the medical history, and the fertility clinic's preferences. The outcomes of previous IVF cycle are also taken to decide the number of embryos. If the woman has undergone a previous IVF cycle and then there was a failure, then there is a tendency to transfer more number of embryos and also rigorous criteria for selecting the embryos. For example, the embryo selection can be happened by two methods. In a conventional lab, on the second day, third day, or fifth day, depending on the policy of the clinics, the embryos are assessed for their grading and the number of cells and the number of embryos that are available. And as a policy, most of the clinics transfer 2 embryos, and rarely in selected situations 3 embryos are transferred. And in Krishna IVF, we follow a different selection method which is based on time-lapse monitoring, in which the embryo is assessed throughout with the help of integrated cameras by a technological time-lapse, where we get the information on hour-to-hour, minute-to-minute performance of the embryo, and based on the rate of the cell division, the events that are happening in the embryo, are they matching to the ideal parameters, and based on that, a deselection of embryos is done, and the selected embryos, of which 1 or 2, depending on the policy of the patient, policy of our clinic, and the situation, are transferred to get the best possible outcome. In conclusion, the process of embryo selection depends on assessment of embryo morphology by microscope or by assessment by time-lapse technology is how the embryo selection is done. But the number of embryos to be transferred will depend on your age, your previous failures, your uterine condition, and the policy of that particular fertility clinic. It's ideal to discuss with your consultant that how many embryos they are transferring at what stage, and this video is only a guidance for you to understand how selection of embryos happen in an IVF clinic. Hope this video was useful. Have a wonderful day till we see you next time.